I'm going to give a tour of the 4 specimens of the lung. I'm going to pick this first one down here because it's stained with H&E, and then we'll look at the ones that are stained with a trichrome stain, and then elastic fibers, and then reticular fibers. So in the H&E, at the very low power, and we've given you some annotations. For example, you can zoom in on a bronchiole that we have labeled, and you need to study that and make certain that you understand the difference between a bronchiole, which lacks any cartilage in its wall but still has smooth muscle. So when you zoom in on that, you can see the smooth muscle right here, and then the epithelium. So and then this is a pulmonary artery that's lying adjacent to a bronchus. And so here's a large bronchus here, and a smaller bronchus, and even this well, over here, this is actually an artery next to a vein. So and we provide also annotation for the respiratory bronchioles and alveolar ducts. So use this specimen to study those major structures, and then zoom in on the alveoli, where you, in this case, the alveoli, the capillaries in the interalveolar septa are pretty much engorged with red blood cells. And so looking at the individual alveoli here, you can just barely see the nuclei of the lining, and for example, here is a fairly large cell, and I can artificially enlarge that just a little bit, and that would be an example of a type 2 pulmonary cell, or a type 2 pneumocyte that secretes surfactant, and another one over here. If you find any cells within the alveoli, those will be macrophages crawling along. Okay, so let's go away from this one. Be sure to peruse the entire specimen and try to understand what you've learned in lab and apply it to this specimen. Okay, so let's go now to the specimen that is stained with trichrome. And with the trichrome, you can see where the collagen fibers are a part of the wall, but this very thin stained red, this is smooth muscle. That's a part of a bronchus. And if you then say look at well, this is an artery. You can see the very flat lining. It's a very small pulmonary artery. And if we zoom out and go back, we've actually labeled a terminal bronchiole here. So in the terminal bronchiole, it's very, very tiny. And actually, this is the very last part of a small bronchus. And from this point on, it only has smooth muscle in the wall right here, epithelium, and then collagenous connective tissue that is immediately adjacent to the lining of alveoli close by. So you can look around in this specimen, like for example here is most likely a type 2 pneumocyte, and these very flat nuclei on either side of an interalveolar septum, in addition to the capillaries, that would be a type 1 pneumocyte, which is forming the blood-air barrier. Okay, now let's stop this video, and then I will use a separate video to do the reticular fiber specimen and the elastic fiber specimen.